Hi, I'm Alicia and this is my NG tube video. I have reviewed my orders and I know what procedure I need to do. I need to remove some contents from the patient's stomach, so I know that I need to use a large bore tube. I've gone over the procedure with the patient. I've obtained informed consent. I have identified the patient with 2 identifiers, and I've also done a focused assessment. So I've asked them about nausea, vomiting, when their last bowel movement was, when they last passed gas, if they're hungry. I've also auscultated their bowel tones and palpated their abdomen. And so we're ready to begin the procedure. So I've made sure the patient is in a high Fowler's position. I'm going to cover them with a towel. And then I'm going to start by looking into their nostrils to see which one is larger. Okay. And then I'm going to ask the patient to occlude one nostril at a time and blow out so I can see which one is more patent, and then we'll put the tube into that nostril. For demonstration purposes, we'll do the right nostril. And then I will open up the tube, get it all ready, and then I'm going to measure. So I'm going to start by going from the tip of the nose to the earlobe, and then from the earlobe down to the bottom of the xiphoid process. And I'm going to mark that spot with a piece of tape. And once I have that marked, I'm going to lube the tube. I've set up all my equipment ahead of time, so I'm ready to go. And then I'm going to hold the tube about 4 inches down, and I would have the patient slightly tilt their head back, and I would push the tube in until they gag, and then pull it back out a little bit until they stop. And then if they could sip, what I would have them do is tilt their head forward a little bit, and then take a sip, and then I would push in until we get to the marked point. Since it's a dummy, I'm not going to have them tilt their head forward.
Rachel said they were patient identifiers. Go get a date of birth. I will assess my patient, so I'm going to ask my patient.
Okay. And once I get to the marked point, I'm going to tape the tube to the nose. And then once I'm there, I'm going to make sure I'm in the stomach. And I'll do that by pulling out gastric fluids, and I should see some green fluid come out. And I'm getting a little bit here. So I just need a little bit, so what I'm going to do is I'm going to be really careful and remember gravity is my friend and remove this. And I'm going to check and make sure this is gastric contents by putting a little bit into the emesis basin, just a tiny bit there. And then my pH strip, which I had ready to go, I'm just going to dip in and then pull it out and assess the color with the strip, and I'm at a 4 pH, which is what I would be looking for if I was in the stomach. So I know I'm in the right spot. So what I'm going to do is fix my tape job. So pull this off gently.
So now we're ready to place them. I'm going to go ahead and give the
Being careful not to move the tube from where it's supposed to be.
We're going to use water that you can sip on so that when I do place it,
And then my tape is ready, so I'm going to put the end on the nose, and then careful not to get any ripples so I don't
so first I'm going to put it into the nostril.
impact the patient's skin. I'm just going to do a spiral tape job, going in opposite directions.
Lubricate.
So we're also going to perform a focus
Okay. And now that this is nice and secure, I'm going to flag the tube
So that's after
Right here.
so right
and safety pin it to the patient's side, the side that the suction is on their gown. Careful not to poke the patient.
Right side. So I'm going to put you up in high Fowler's, which you're in high.
So now we're going to
Tilt your head back for me.
so
Okay. And then what we'll do is we'll hook them up to suction.
Put your head on down,
So?
down right where the start on chest, and then come through.
Going to grab the tube,
We're done.
turn the machine on.
Swallow every time I push.
And then for this,
I'm on continuous, and I'm also making sure I don't bother any other patients. And I'm just making sure I have a section. I want it to be between 65 and 74. And then once I have it in the right spot, what I'm going to do is turn it over to intermittent. And then I'm going to come over here, make sure my spike stays on the tube. And then I'm going to hook the patient up and make sure the stomach contents is flowing into the vacuum. And if everything is flowing properly, then I would clean up, make sure the patient is okay, wash my hands, take my gloves off, wash my hands.
after this, we're gonna switch